a challenge to dignity. Our goal was to link academics, activists, and agencies concerned with the health of refugees and asylum seekers in a spirit of collaboration and comparison, bringing together professionals working with different populations of forcibly displaced peoples, ethnic groups, and nations. The video you are watching will contain an individual presentation edited to stand alone. We hope you find them to be of value. And our first presenters are Doctors Victoria Ojeda and Jose Luis Burgos. And I would like to briefly introduce them. Dr. Ojeda is, let's see, where is she? There she is. She's professor in the Herbert Wertheim School of Public Health at the University of California, San Diego, and is also appointed in the Department of Medicine at the UC San Diego School of Medicine. Dr. Burgos is an assistant professor in the Division of Global Public Health at the UC San Diego Department of Medicine. The title of their paper is Understanding the Health of Asylum Seekers, Refugees, and Migrants through the lens of student interns at a student-run free clinic on the US-Mexico border. Vicky and Jose Luis.
Thank you very much, and thank you very much, Dr. Sordas. And it is a pleasure for us to participate in today's conference and to talk about our qualitative study on the impact on experiential learning in Mexico among students in their understanding on vulnerable migrants' health. Okay, so let's start the presentation. Okay, so how do I move? Oh, so experiential learning can be a significant aspect in allowing or permitting students or for learning about global health. And it's there's a body of literature that has studied the importance of taking information or learning from classroom into experience in order to have students able to connect, have understanding on real life experience on aspects of diverse settings, reflect, and then explore. And this is the study site. So the study site is Tijuana, which is the busiest border in the world, and is a receiving site or main receiving site for migrants, refugees, and deportees, and asylum seekers. And it's and here as we show in this slide, the migration patterns in this region change dramatically and have been changing for a long time. So the specific study site is Health Frontiers in Tijuana, which was started in 2011 in order to bring collaboration across the border and to bring opportunities to learn about migrant health and global health. And here we're showing some of the patients that are seen at the clinic and some of the images on site of the clinic, where you can see a combination of students from San Diego, from Mexico, and also collaborators from both sides of the border and patients. And from this program, we have courses that were created for both university in Mexico and in the US. So it's an equal learning partnership and opportunity where it combines weekly classes with clinic-based activities on the site. And actually, it is a student-run free clinic in the sense that students take care of registration, help clinicians do vital signs, and also shadow and support consultations. And since 2011, we've had over 400 students participate in this program, including a leadership group that formed from students who actually have taken the course or the experience for several quarters, and actually they actually influence or have significant collaboration as far as tailoring the program. So I'm going to let Dr. Ojeda explain as far as the methods.
Great, thank you. Thank you. It's nice to be here with you all this morning. So we conducted a focus group with some of the students that have participated in the HFIT internship program. And our goal with these focus groups was really to learn how this experience has supported their understanding of refugee, migrant, and asylum seekers' health. And in addition, to understand how participating in HFIT has supported their professional development. Many of the students in global health programs and are interested in pursuing health professions careers or careers in research and academia. And so that was our goal, was to elucidate those particular areas of the contribution of this internship. So this year in March, we conducted Zoom focus groups with 27 student interns and members as well of the leadership board. And we recorded the focus groups, transcribed them, and analyzing is the thematic analysis. And so we'd like to present some of the results today. So on average, the students were 23 years old, and primarily female with 82%. Interestingly enough, Latinx students represented nearly 2/3 of our participants. And similarly, 2/3 were first generation students. And you can see on the right side of the slide that half of the students had the opportunity to participate in person. That was sort of pre-pandemic. And other students, about 1 in 5, participated virtually throughout the pandemic. And 30% were able to engage in multiple strategies, both in person and virtually. And you can see here that, as Dr. Burgos mentioned, HFIT is an opportunity because of its proximity to the UCSD campus and the border that allows students to engage long-term. As a result, nearly half of the students have participated multiple years, and 37% were in the leadership boards. So with respect to what we learned about their knowledge of migrant, refugee, and asylum seekers' health, we found 2 themes emerged from our interviews. In the first theme, we found that some students really didn't have any contact with migrant communities, and as a result, really didn't have any knowledge of migrant health issues. And so those are some of the quotes that you'll see in the top half of the slide. And with respect to that specifically, maybe they had familiarity with what was conveyed in the media, but not firsthand knowledge. And they talked about, coming from very white communities and not realizing that there were different communities, different languages and cultures, thinking that Mexico was a community of Mexican migrants that were, transiting to the US. The second theme that emerged was that students had some knowledge, maybe firsthand knowledge, having come from families with migration histories themselves, but they were less familiar with the political, the social context of migration, of the health issues that affect them, maybe lacked some of the theoretical concepts that we study in global health and public health as well. And so through participating in the HFIT program, they were able to, as the second student described, through HFIT, I was able to more formally conceptualize the different issues among this population. So that was very interesting to know. And you can see here, this slide represents some of the students that are out in the field and the kinds of activities that they're engaging with. On the top left, you can see a student preparing for his day in the field and engaging with students, shadowing, taking vital signs, helping to organize the pharmacy, organizing activities for the youth in the community, and even participating with their Mexican student counterparts with guest lectures that we've organized. In addition, we learned that participating in the HFIT internship program raised their specific awareness about migrant health And the themes that emerged here were that students gained an understanding of the different kinds of migrant subgroups that come to the border that are in Tijuana and just their actual experience. So I'd like to share this quote. I was also around when the Haitians were in TJ in Tijuana. And I remember there's a big difference between Haitians and the deportees, because deportees were mostly men from what I remember. And then with the Haitians, we started seeing a lot more women and children at the clinic, and they have different needs as well. And so you can see this student has had the experience of participating in the long-term HFIT internship and is able to compare and contrast sort of the communities, their needs, and how their health profiles present over time. The related theme was that students' engagement with patients directly and in these different structured stations facilitated learning directly from the patients themselves. And so this student described going to UCSD for undergrad. We would go down to Baja for more like on a tourist basis. Once I got to work with HFIT, you get to talk to these people one-on-one, hear their stories. The complexity of their backgrounds was really mind-blowing. There's so many things that they're dealing with besides just trying to migrate and think about all the health issues that they're dealing with that are stacked upon each other and family issues. And so it completely opened my eyes in like a very humanistic way to what migrants are dealing with. And again, that's one of the goals with the HFIT internship program, is to really humanize that migrant experience through direct contact, through stories, through narratives. And you can see the sites that the students are engaging with. In the middle here, we just showed an example of the migrant caravan that was one of the recent waves of migration. And again, that helps to bring it down, the news, the media, and kind of dispel some myths that they might be otherwise experiencing. As I mentioned, HFIT supports long-term engagement and understanding of students' health, of migrant health, over time. And so here, one of the themes was that social determinants of health become evident at each visit, and how migrants experience these social determinants of health vary. One of the very positive aspects of HFIT, as I mentioned, is the proximity to the border allows students to walk across the border, experience that migration themselves, engage with the local community and all, the sights, the smells, the sounds that you hear as you're crossing the border. So this student commented, at HFIT, you can see how people who are sleeping on the streets or exposed to the elements really have different health outcomes. And a lot of times what they need in order to be healthy is more social service support outside of healthcare support, right? And so that student has kind of been able to contextualize the role of these social determinants of health, of housing, as part of health needs in comparing, the services provided at the clinic. Another student commented with ACEs, that is adverse childhood effects, and showing connections between childhood trauma and health outcomes was really eye-opening, not only with the patient population. This particular student is actually going on to become a teacher, had a goal of becoming a psychologist when he first started in HFIT, but transitioned to pursuing now a master's in education as a result. And so he mentioned, I'm going to tie it into my career choice now, like teaching, like seeing students have aspects of trauma in their own lives, how it affects their learning. And that was something that I got from the clinic. And so what we see is a lot of translation from these very specific experiences in Mexico and Tijuana at the border with migrants to other careers, to other populations, but pulling in those academic concepts and healthcare concepts. And students also gained appreciation of cultural dimensions of health. And so this student talked about the clinic opened my perspective on what cultural competency and cultural sensitivity meant, not only in the context of HFIT in Tijuana, Mexico, but applying that to underrepresented groups in California. So again, we're seeing kind of this broader translation and understanding and connection to other communities, underserved communities. I'd like to share as well that one of the goals of HFIT certainly is to support students in gaining that experience of healthcare professions before they pursue their graduate degrees. And we did have information about their personal and professional growth and how the clinical experience ties into that. So we had 5 emergent themes related to professional growth. And students talked about having improved communication and having a better understanding of patient care. And so here they said, HFIT gave me a better understanding as to how personnel and healthcare can approach people who are from migrant backgrounds or from different backgrounds from ourselves to really help understand a little bit better where they're coming from. And again, I tie that directly back to that personal engagement that they're having on a long-term basis. They learned about collaboration and teamwork as being important for not only their activities at HFIT, but for their future careers. So this student cited being that in the leadership group, they were able to collectively work together and help people. We're able to learn together as a community because we're able to communicate with more people because we're able to stay there a little bit longer and we get to know everybody. So there's a lot of peer mentorship that's happening and growth of a community. And students learned about healthcare administration, and we saw that some students had affirmation of health profession as a career choice. So HFIT, I guess, more so reaffirmed my goals. I was pre-med and I'm pursuing MD or OD, and HFIT reaffirmed my want to go into family medicine rather than going into a specialty. And that's also very interesting because what we see is that exposure to working with underserved populations means that potentially we're helping to build that pipeline for primary care as well. We saw students pursuing new careers as a result of participating in the internship program. And I've given some examples here, which is research, master's in public health, nursing, teaching, psychology, and for some students, gaining a passion to go to medical school. So this student juxtaposed here that they always intended to go to medical school, but now they're realizing that they would like some time to focus on disparities issues. And so she said, the student stated, I might get my master's, I might do research full time, but something along those lines, because it's still really interesting to me. So again, having the opportunity to really concentrate in depth has also supported growing the research pipeline with Latinx and first gen students who were predominantly in our student population. 8 students find that they're building community and they're finding alumni and colleagues in the field. And that's also, I think, very gratifying, as I mentioned, having a community of HFIT alumni. I've mentioned that we have over 400 alumni, and they talked about being part of the leadership group gave me a sense of community, to be part of something. And they gave me very useful advice and someone to lean on for support, as and the rest of this quote talks about how that student was preparing for graduate school, and so being able to get feedback from other students in the field. But I just came across a student yesterday, actually, that just got hired onto a community clinic here in San Diego that I'll be able to work with. So, so there are a lot of sort of professional benefits. And this slide here, that you could see that for in terms of their current academic status, we did have almost half of our students in undergraduate, but 1 in 5 were med students. We had a PA, and another one that was in Master's of Public Health or preparing for medical school. And then those that were working in health professions. So that was very interesting to see. And again, here's some examples of the kinds of leadership activities that students undertake, which range from fundraising to meeting with funders to doing outreach and promoting of the clinical internship. And I'll let Dr. Burgos talk about the virtual internship that he organized during COVID, because that was very interesting.
Oh, thank you, Dr. So these are images of when COVID hit and students were not, for safety reasons, allowed to come to the clinic. The program showed resiliency because through the use of Zoom, the use of technology, we were able to continue the clinic. It is a student-run free clinic. Nobody was hired to do some of the work the students do. So here you can see images where students are doing registration. We had like kiosks where patients would come in, a student would open their files. They would work with the provider. Some of the students were scribing during the interactions. Students were asking and collaborating with psychologists on the field as far as asking for mental health issues or social determinants of health with the clinicians or social workers, and show a significant, resilience in the sense that the program continued on. And if we go to the current situation, now we're in a combined. We're thinking that we will keep some options for virtual. Right now, we have students from Mexico and from UCSD joining together, and we have students online. For example, in the Midwest, we have a student who he was not in San Diego right now, and he wanted to start a program on relaxation and meditation for lowering stress among patients. And he was able to connect and provide services in that sense.
So in the interest of time, I'll just kind of wrap up our presentation, but we feel that the HFIT program has been a very promising program in terms of reaching and engaging diverse undergraduate students that might not otherwise have access to health focused opportunities, which oftentimes will have GPA or other restrictive financial requirements. And our program kind of overcomes a lot of those barriers. As you saw, HFIT really is experiential learning. They're out in the field. It's a whole person immersion. And students really are able to kind of connect academia with real life issues as they pertain to migration and health. And as Dr. Burgos mentioned, the virtual HFIT program was successful in getting students engaged. However, that immersive experience that is part of that experiential learning process of hearing, smelling, seeing directly, being out in the field, that piece was lost. But there are some benefits to that. And I think, as he mentioned, we will retain some components for students that are not able to cross the border. I think it does allow for their continued engagement. And we do feel that the program is successful in supporting students' pursuit of global health and understanding how they might bring their careers to include migrants and other underserved populations, and also opening their eyes to the role of academia or blending the two, service and academia. So in conclusion, we are very appreciative of all of your time this morning and look forward to your questions.
Questions here? Yes.
First, congratulations to both you, Vicky, and Jose Luis, for your leadership. I mean, you've really taken this from what was a dream. It took 3 years to get this program approved. And it's one of the benefits that I see is that it promotes cultural competency, but in a horizontal way rather than a top-down way, because an organic nature of the program is that the students from Mexico and the students from San Diego really learn from each other. And I could tell from some of the really interesting in-depth interviews that you did that it seemed that HFIT played a role in erasing or minimizing some of the implicit biases that they had. So I wondered if you thought that that was the case, because that just seemed to emerge from some of the themes that you presented. Thank you.
Yeah, absolutely. And, when we talk about the number of students that have gone through the program, those are only the UCSD side. We haven't even mentioned all the side from Mexico that has been engaged. But I think having that close proximity to the community, to other academic institutions definitely helps. But like we said, to humanize and to really allow students to process and to compare and contrast what they're seeing kind of in media and social media to what is the complexity of people's lives. And so that helps, I think, too, like you said, reduce that implicit bias. And it would be something very interesting that we could study and somehow. Dr. Burgos, do you have anything?
And also, I would emphasize, the combination of UCSD and UABC, or students from both sides of the border. We've seen now students that are now professionals in Mexico who have a different attitude towards migrants and homeless population, because now they understand the context. So I think that's a critical aspect for for the future generation. Yes.
And I'll just add, as we have here, thank you for you and Tom for all of your championing of, everything HFIT. So, we're very indebted to you and to all the students that have participated to bring it up. Yeah. Yes.
This is actually a related question. I was curious, both sort of in these focus groups, I was really interested in that aspect of the different groups of students coming together and working together. So both if the UCSD students sort of talked about what they learned or their interactions with the students, the Mexican students, and similarly, if you were considering or planning on doing the similar related kinds of focus groups with that set of students or combined focus groups to see sort of what they're getting out of it and how the sort of learning processes relate and interrelate.
Sure. No, I think it's a phenomenal idea, and that's something that we could certainly do, in the near future. We haven't kind of gone in depth on that side. We really kind of wanted to learn more just about, the refugee side and the professional development. But that learning piece would be its own focus group. So I appreciate the suggestion. Yeah.
I have a question.
Yes.
So this program seems like it would be great for not just students who are interested in medicine or the health professions, but just in general. I mean, just in kind of growing social and civic consciousness among people in general. Do you have any plans to make this opportunity available or to kind of target other groups of students who might not necessarily be inclined to participate in a program like this to grow that?
Sure. No, we definitely do open it up to the UCSD community. And other students from elsewhere have volunteered. So we're not limited in our scope of participation. We had a very exciting group of students from bioengineering come maybe about 4 years ago. And that was very interesting. We did it as a pilot with that program and they brought their perspectives. But we always say, if any student is interested in this opportunity, please apply, because we think that there's so much room to participate, to innovate, and to kind of contribute your perspective, to this. And because there's very little bureaucracy, we have flexibility to really take it where students are interested in growing. So thank you.
We have one question that's come in from our remote participants. This is from Danielle Montejano of UCSF. Thanking you for this wonderful presentation. How does HFIT provide opportunities and resources for underrepresented students from a first-generation migrant refugee asylee background earlier in their academic career? For example, those looking to apply to graduate education. Does HFIT provide any mentorship to middle school or high school students?
We haven't gotten to middle school or high school, but we have, between Dr. Burgos, myself, and the faculty that we collaborate with and know at UCSD, for example, and other institutions, have supported students to do research projects that help them to build their curriculums. And sometimes they're funded and sometimes they're not funded, but we've supported a fair number of students in terms of applying for example, campus opportunities like the Trells Fellowship, McNair Scholars, and then of course, writing letters of support as they're applying for graduate admissions. We've had several students that join our groups as RAs, research assistants. So there are different opportunities and we try to steer them to those that have financial components as well as much as possible. But that is one area that we would love to grow, is to be able to have fellowships and to be able to offset, for example, even transportation costs to the border and things like that. So I think that's one area that we would love to grow in.
Great. Thank you, Vicki and Jose Luis.